Hi and welcome back to Zoost. Now at the moment hedgehogs are really in the headlines. A lot of them get injured, a lot of them suffer due to man-made things such as roads, garden implements, fencing, plastic litter, etc. Now recently hedgehogs have been classified as an endangered species in the United Kingdom, and we at Zoost want to do what we can, and for years I have been treating hedgehogs, and I thought you might like to see some of the work we've been doing. Now this first case I'm going to show you is of a hedgehog that is very weak on its back end, and it had been found caught up in a load of garden plastic waste, sort of netting, and it wasn't using the hind limbs properly, and when you see the clip you'll understand what I mean. I do apologise for some of the footage. We are literally trying to film these whilst running the clinic, so it's not a set up studio. This is in a working wildlife hospital, so have a look at the clip coming up. I'll talk through what I'm doing, and then I'll meet you at the other end. Now, in order to see what the problem is, it's always a good idea to try and watch the hedgehog moving. And hedgehogs are wild creatures and they are often very shy. So here I am using a technique we often use, which is called tickling the spines, and in most cases it will encourage the hedgehog to move. You'll notice a little bit of red on the spines. That is actually nail polish used to identify the different hedgehogs when we have more than one per kennel. Now, the unusual thing with this little fella is that you can see the hind feet sticking out behind it when it walks. Now, normally a hedgehog will stand up a bit more and you won't see the hind feet left on the floor or on the ground for quite so long. So just watch as it turns round and then walks away. Apologies for the shakiness of the footage. The room is quite small that we were working in, and I was kneeling down, crouching, trying to film, and there you see the hedgehog is pretty flat on the ground and the feet are going out behind. This is not a normal hedgehog gait. And this is it moving slightly faster. This will be after the first treatment, and just watch again, and now we've got a little bit of dragging of the foot, so we've got some kind of neurological problem going on. X-rays all look clear. The vet was happy with that. You can see every now and then you see the feet and lower parts of the legs of the vet. I'm not working on my own, I'm working very much with the veterinary team at the hospital. And so time for a bit more investigation and handling as part of the treatment. I tend to wear gloves when treating hedgehogs. After 30 years of osteopathy, my hands are actually quite sensitive to touch and feel, and having hundreds and hundreds of little spikes sticking in them with a jumpy hedgehog doesn't help. Now you see I'm gently bouncing the hedgehog, and this is to encourage it to use its hind legs. And the idea is that you start waking up the neural pathways, not just to the legs but through the whole spine, and wake up what we call the proprioception, the knowledge that the impulses from the nerves in all the joints and muscles send back to the spinal cord and brain to tell this little individual where its feet are. And we do the same things whether it's a person or an animal, in that we're trying, where there's any kind of nerve interruption, to try and get those pathways open again, assuming that they're not so badly damaged that you can't get messages through. But you can see with this little chap, he's actually engaging with the ground or the top of the table, and as I'm lifting him like that, he's pushing, and so almost in an involuntary way he's pushing. Now I've taken the glove off and I'm using a finger either side on the top of the cranium to just work with the tension at the top of the head of this individual, because when you've got any kind of compensatory pattern with movement, it will affect the rest of the body. And you'll have heard of muscles and tendons and ligaments and bones, but the other thing that's involved heavily with this is an organ called the fascia. And it is an organ because it envelops and surrounds every part of the body. And fascia is there to both envelop things but also to reduce friction, so that when we move we haven't got organs and muscles rubbing against each other creating lots of heat, because if the fascia wasn't there, we could generate so much heat that we would actually cook the tissues. So it's important as an organ that the fascia is functioning normally. And now I've got my gloves back on, I'm actually going to work further through the muscle chains and the fascia, because everything is connected. We might give muscles different names, but if you ever dissect anything, you'll discover that they all sort of blend in and they are often continuations of each other. So it can become very difficult to isolate some of the muscles in the body. Not all of them, some of them are very easy to isolate, but others aren't. And hedgehogs, when they're healthy, will often move around a lot. So you'll see I have to keep repositioning this little one. But it's good. He or she's pushing against me, and I'm using my hands and the table as a gym. So as you can see, hedgehogs are treatable with osteopathy. They are handleable. Most of them are fairly biddable during treatment. Not all of them, but the majority are. The next video we're going to put up after this one, we'll see a hedgehog with a different injury, and you'll see how I cope with that one. But until then, please stay safe and please stay healthy.